everyone, we are going to continue our conversation about curve patterns and how important it is to understand your unique curve pattern if you have scoliosis. So first, the best way to understand your curve pattern is to get a full spine x-ray and have someone who really understands scoliosis take a look at that x-ray. I would recommend finding a Schroth certified therapist and have them go over your x-ray with you and really teach you your curve pattern, because everyone is different. And what I'm going to talk about is really just general things, some things that you can start thinking about, but really not a substitution for getting that one-on-one teaching and analysis. So when you think about scoliosis, it's really important that we start to think in 3 dimensions, because scoliosis is always affecting how we move in all planes of movement. So some things to think about is, first you want to start thinking about where your pelvis is in relation to the rest of your body. So for most individuals with scoliosis, the pelvis is shifted either to the right or to the left. And so if you think of my stack of blocks here, this block can represent your head and shoulders. This block can represent your thoracic spine or rib cage. This block here would represent the lumbar spine or the low back, and this last block would represent your pelvis or your hips. So in most individuals with scoliosis, your pelvis or your hips is shifted a little bit to the left or a little bit to the right. And so it might kind of look like this, where your nose and your belly button aren't always in a straight line. You can also think about the spacing between your forearms and your hips. So if you're standing up, you would think about, are my hips touching my forearm on one side, and is there space on the other side? That might give you an idea that your hips are shifted to one way relative to the other. So something that you want to know is where your hips are and how your curve is making you go in that direction. So that's one thing you can think about. You can also start thinking about the side view. And so here, if we imagined that we spun you around and we're looking at you from the side, we're thinking about keeping your ears over your shoulders over your hips, and your hips over your ankles and standing. And so for some of us, we tend to hang out with our pelvis a little bit forward. You might need to pull that back. Maybe your head is coming a little bit forward and you need to bring that back into alignment. So you want to think about this side view generally too. The other thing that you want to start thinking about from the side is any rotation that's happening with scoliosis. And this is really happening in a different plane than bringing your pelvis into alignment from left to right, or thinking about lining up ears over shoulders, shoulders over hips, hips over ankles, because this is really a rotational movement. And so most individuals with scoliosis have some rotation happening too. And you might find that your rib cage is rotated back on one side, or your lumbar spine is rotated back on one side, and it's creating this concavity or space that we then need to think about addressing. So this gets fairly complicated fairly quickly in terms of wrapping your head around this 3-dimensional movement. And so that's why you really want to find someone who can walk you through your unique spine and look at your imaging and match that to what they're seeing clinically and help you understand that full picture. Just basics would be, you want to get your pelvis in midline. You want to think about putting equal weight through your feet when you're standing. Keep your nose and belly button lined up, and maintain ears over shoulders, shoulders over hips, hips over ankles. If you start there, that's a pretty good starting point. And then to get into the details and the specifics, you really want that one-on-one coaching. But I would encourage you over the next few days to think about maybe your pattern. Do you tend to hang out with weight on one foot more than the other? Can you tell if your hips are going to one side or the other? If you look from the side, are you able to keep a nice line of everything lined up, or are things a little bit out of balance one way or the other? And start there, just reflecting on your own movement, and see if you can make some changes to be in a little better position. And then please either reach out to us or a Schroth PT in your area who can give you some help and guidance on the uniqueness of your curve and how that affects your movement, because that really is the first most important step to being able to do scoliosis specific exercises with success.